Hi, my name is Parisa Charmchi-Goodwin, and I am the Executive Director of the Commission on Racial Equity in Public Health. Healthcare policy shapes lives every day. Recently, the federal government made significant changes to Medicaid and Access Health that will affect families, providers, and communities across Connecticut. These are the biggest changes to our healthcare system since the Affordable Care Act. Over 100,000 Connecticut residents are projected to lose their health coverage in the coming years, starting in the next few months. Many people think these changes will only impact a small group, but coverage losses strain the whole system. Here's how.
Hi, I'm Dr. Brittany Liebla. I'm a doctor of nursing practice, an addiction medicine specialist, and senior APRN with CHR. When my patients lose healthcare insurance, they don't just lose access to care, they lose hope. They lose sight in a normal future and regaining their life back. I don't typically talk about why I got into addiction medicine to begin with. When I was 23, my brother died of an opioid overdose, and I threw myself into addiction medicine treatment. But the reason I stay is because of my patients. I get to bear witness to their near impossible self-reinventions every single day, made possible because of healthcare insurance. Recovery happens because of healthcare insurance. We have to look at community health as a whole. And we know that patients of lower socioeconomic status bear the burden of worse health outcomes. That is beyond politics. That is basic community health care. So you don't want to lose addiction treatment in your community. The consequences are vast. And the reality is that translates to community health centers and nonprofits not being able to deliver that care.
Hi, my name is Aisha Clark, and I am the Executive Director for Health Equity Solutions and the co-chair of the Commission on Racial Equity and Public Health. So the federal changes are really going to have an impact in our state of Connecticut. It's important for our lawmakers and administration to really listen to those with lived experiences so that they will be able to ensure that we will keep individuals covered. Those who are marginalized, especially our Black and Brown communities, and those who are in low income will bear the burden of these administrative barriers. The changes are intentionally convoluted and they are rolling out quickly. And it's not leaving time for those who are enrolled to stay enrolled. And there is no way for them to learn about the administrative traps that are happening for them to stay enrolled. There is no exaggeration. People will die with these changes. So we need to respond quickly with laws, processes, and oversight that will keep people covered, sustain our health system, and listen to people with lived experiences. Let's be clear, without Medicaid, also known as Husky, many people will lose care. Providers will struggle with less revenue. And if providers go under financial strain, where will people go? It's important for us to do something now.